Welcome, Gold Delegates. I'm Fleur Bickford, Program Director and MC for Gold Perinatal 2015. I'm here today talking with Carrie Sue Halsey, and we're talking about her upcoming presentation titled High Nurse Intervention Birth. So Carrie Sue, welcome, and thank you so much for chatting with me today.
Thank you. I'm happy to be here.
Wonderful. So to begin with, we'd just like to learn a little more about you. So I'd love to hear a little bit about your professional journey and how you became interested in perinatal care.
Well, it started with my first baby. I was a very young mother, and I sought OB care through public health, and I did not have a very empowering experience. My second baby, I had an amazing team of nurses and an obstetrician that really cared and listened to what I needed and what I wanted for that birth, and it was a completely different experience. And that is when I decided I wanted to become a labor and delivery nurse. And so I went to school and became a nurse, and I have been taking care of patients for the last 10 years in OB, and I just love it.
Wonderful. It's amazing how, I find so frequently in this field, a lot of us come to it because of our own experiences as mothers. So really interesting to hear about that. So tell us a little bit about perinatal empowerment. You mentioned that with your first birth, you didn't feel very empowered. So I love the name of your website. It's titled perinatal-empowerment.com. And in your biography, you say that you're a passionate crusader for perinatal empowerment. So just tell us a little bit about what you mean by that and why do you feel it's so important?
I think that perinatal empowerment, it doesn't mean that everybody should have a home birth or everybody should do X, Y, or Z. It is safe care for moms, so it's empowerment for nurses to advocate for their patients for the best care possible, but also it's empowering mothers and dads to not go into a hospital and have things done to them, but be an equal partner with their perinatal professional team.
Okay, interesting. And I think it's such an important point because I think so often parents don't feel very empowered and they do, just kind of go along with whatever the doctor says and they end up feeling, very disempowered coming out of it, which is a real problem. I find it very interesting that you talk about the nurses being empowered too. That's really interesting to me. Do you find that sometimes, that's a problem for nurses about not feeling empowered to advocate for their patients?
Absolutely. L&D, labor and delivery, it's a business. And as much as we want to care for our patients, we have bed issues like trying to move people out to discharge. We have lots of pressures that are not nursing pressures. And we work with great obstetricians, but their model of care is medical. And I feel that we're losing some of the hands-on nursing care that we used to have a lot of in birth. So there's a lot of obstacles that nurses have to face. And then when patients are asking for things like they don't want epidural and they don't want their water broken and they don't want, they want to eat, like things that really have some evidence behind them, a lot of times they meet a lot of resistance from the medical staff, and nurses need to be empowered to stand up for their patients and say it's okay for this mother to get what she wants on her birth plan. It's safe. There's evidence saying that it's safe. Let's do this for her.
Okay, interesting. And I know I certainly remember from my days of working on labor and delivery that it's, it can be very difficult, to stand up to, in particular the obstetricians and stuff. So really interesting. So tell us a little bit more about your presentation, and love for the delegates to hear a little more about just briefly what you're going to be talking about. It's titled High Nurse Intervention Birth. So maybe just tell us a little bit about what you're going to be touching on in your presentation and maybe what you hope the delegates are going to take away from your presentation.
Well, I've noticed throughout the years that we're starting to do a lot more nursing from the nursing station, and the high nurse intervention birth means the nurse is doing a lot more interventions, nursing interventions. And these can be very simple things. And in the presentation, I talk about like just applying a cold washcloth is extremely important to the patient, just as important as the timing of her epidural if she wants that. It's for her comfort and support during labor. And A1 really emphasized that in their position statement about supporting women in labor and how an OB nurse should be with the mother throughout her entire labor. I have found I am an OB instructor, and I also precept. I've been an educator, and I find that nurses just don't have the skills anymore, and they want to take care of the increasing population of patients that come in wanting low intervention birth, but their toolkit involves epidurals and sideline positions and monitoring from the desk, and they're losing these skills or they don't have them. And so they have asked me so many times on the floor, well, I don't even know what to do. I don't know what to do with a ball. I don't know what to do with all these things that you do. So I feel like it's very important to get that message out there. That's part of my website, and that's why I'm so excited to share this information here at Gold.
Fantastic. It sounds wonderful, and definitely really looking forward to hearing more about it. And I think it is such an important topic, and it's really interesting to hear you say that, you know, there's more and more nursing being done from the nurses station, and it's, you know, that's of course very unfortunate, and it's definitely, you know, not the best approach for patients usually. And it's so interesting to hear you say that, you know, the nurses are looking for this information. So I love that your presentation is going to provide some more information and options and ways to support people, you know, support moms and families through labor and delivery. So thank you so much for taking the time to chat with us today and to tell us a little more about your talk.
Thank you.
So for our delegates who are listening, you can hear more about Carrie Sue's presentation titled High Nurse Intervention Birth during her live talk, which will be taking place on Tuesday, October 27th at 1700 UTC. And of course, the recording of her presentation will be available throughout the conference.